The content discussed in this episode may be specific to the guest's organisation or location and may not be applicable to other organisations, states, territories or countries. The material presented in this podcast is for general information purposes only and should not be considered health, legal or financial advice. Medical administration is a rewarding profession, but it comes with challenges. So what is it like, and what should you do if confronted with a monumental administrative difficulty? This is the podcast that takes unfortunate scenarios and explores the essentials of clinical governance to find solutions. I'm Dr David Rankin, a very experienced medical administrator and lead fellow with the Royal Australasian College of Medical Administrators. And this is Safeguarding Healthcare, the essentials of clinical governance. Today, a serious breach of privacy.
The organisation has to ask itself, have we breached the law?
That's Dr Colin Feekery, who was, until recently, the Acting Director of Medical Services at Alfred Health. He also spent 10 years as the Chief Medical Officer and Executive Director of Medical Services and Research at Eastern Health, the second largest health service in Victoria, and I'm presenting him with a difficult scenario.
You've really got to go back to basics and ask yourself this fundamental questions. Is this a human error or is this an error of our system?
In this scenario, a customer relations officer emails a complaint they have just received from a patient. The patient has received a letter from the hospital with a detailed discharge summary for another patient who was discharged on the same day. The complainant is surprised about how much information is included in the report and is very concerned that some other patient may have received a copy of their information. They have lodged a formal complaint with the State Privacy Officer and the Healthcare Complaints Office. I started by asking Dr Colin Feekery what issues this scenario raises.
At a very human level, what we've done here is that we've actually released someone's private information, which may have been very important or may have even been quite impactful on their life. The other thing we've done is that perhaps we've uncovered deficiencies in our staff training or in the systems we have. And lastly, I think the organisation has to ask itself, have we breached the law, in the sense that have we actually followed the requirements of our local and federal privacy acts in terms of complying with the privacy principles. So that's the sort of thoughts that would go through my mind.
Thanks, Colin. Let's start with what is private information. Is some information more private or sensitive than others?
Absolutely, yes. And some people's information may be very specific to them and may need to be treated with more caution and more privacy restrictions. So if you're a victim of domestic violence and you are very keen to keep your address private, then that really is incumbent on the organisation to treat that very respectfully and very carefully. So generally speaking, most organisations are required to gather minimal amounts of information, only that which is required to provide the service to the customer. And in healthcare, obviously, we probably do need lots of identifiers so that we get the right patient, and we need to understand people's age, we need to understand their address so we can contact them and their next of kin. However, we probably don't need to know, and this is where some aspects of information are more sensitive than others. So we don't need to know their sexual orientation. We don't need to know that they belong to a political party. We don't need to know that they may have even had a criminal record. So those sorts of things are, if we collected them, we would be in breach of the privacy principles as laid out by the Commonwealth and state governments.
We tend to treat mental health information much more sensitively than, say, outpatient removal of a mole type information.
Absolutely agree with that. And it's an area where the stigma of mental health conditions still exists in terms of employment, in terms of how people are treated. And so it is incumbent on organisations to be very careful about revealing the identity of people who are currently under treatment and what they're being treated for.
As you say, release of that sort of information can have very significant stigma and reputational risks to the person, their employment, their relationship with others, and so it's very sensitive. In this scenario, how do you go about working out how the wrong letter got sent to the wrong person?
Well, you've really got to go back to basics and ask yourself this fundamental question: is this a human error or is this an error of our system? And in truth, most disclosures are unintentional by people who are not really hyper alert to what they could accidentally disclose. And having said that, we need to then look at the systems and say, well, do we have the policies? Do we have the procedures? Do we have the understanding about what security is? And have we really trained our staff in how to observe the principles of privacy as laid out in the legislation?
One of the real challenges is that so much of this sort of distribution of information is automated. It's done by the computer. It's happened once. How can you be sure that it didn't happen a number of other times?
That's a really difficult question because most privacy breaches are discovered by accident. Someone applies for an FOI, and while the staff are reading the chart for release, they discover that the wrong files have been placed in the file and that other patients' information is in it. It's discovered because someone phones you up and says, hey, I got this letter and it's not about me, it's about someone else. So mostly our responses are reactionary. However, I do know that many organisations are trying to draw up processes and procedures where they can start to pick up in real time deviations from statistical norms in terms of detecting privacy breaches. So this might be that they're drawing relationship between a patient, an area, a treating team, and looking to see whether people outside that area are accessing information. They're also looking at clearly statistical incidences of how much each individual staff member is accessing information, whether they drift outside to the norm. Do they need to actually have a review? And of course, lastly, we have to be really aware for victims of domestic violence or prominent citizens in our community who have a prominent profile, that those people would automatically be scanned within an organisation to ensure their privacy has been maintained.
So what instructions do you give the person that received the letter?
Well, if it's a written letter, we would ask them to return it to us. And I know that you, David, have even sent people around to people's homes to pick up the letter to ensure that you actually get the physical copy of it. If it's an electronic version, it's more difficult. All you can rely upon is really ask the person to delete it. And beyond that, it's very difficult to ensure that that information has been completely destroyed.
Of course, there's another person here, and that's the person whose information went to the wrong person. Do you write to them, apologise, tell them what happened, or just hope they don't find out?
Hoping they don't find out is a dodgy and risky business in any organisation. So I think that increasingly our health system is moving to a more transparent form. So now we conduct ward rounds at the bedside where we involve the patient in their care so that they clearly understand what's happening. Similarly, we have regulations in terms of open disclosure, and at least in my jurisdiction, we have a legal obligation under the duty of candour. So I think that if an organisation has disclosed unintentionally to a third party or an outside organisation details, then they need to actually step up and tell that patient. And I think a personal phone call followed by a letter is probably the least you can do. Now, having said that, can I just expand a bit on internal breaches of privacy? So this is up for debate now. Do you tell a patient that you've misfiled within your own organisation their referral letter in someone else's file, and that you've discovered this because you're reviewing the files and you just happen to stumble across it. I think in that circumstance, because it's within the organisation, probably open disclosure would not be required. But otherwise, I think honesty is the best policy.
The other scenario, of course, is when a staff member of the hospital gets curious, knows that their aunt or their uncle or distant relative has been admitted and wants to find out about them, and they use their staff access to look up the computer system. What happens in that situation?
You haven't actually added the other one, which is where they get someone else to access the information. And so then there's more people enjoined in the privacy breach. So this is a comment on the culture of your organisation and the adequacy of your education about what is a privacy breach and what does privacy mean. And so if you are confident that you have good policies, good education, and people clearly understand the requirements of their job, then those people are subject to discipline. And I have known people to be terminated. So when you think about Princess Kate, this is exactly the situation. And I can imagine that within that hospital in London, there'd be lots of investigation about why this breach occurred and who did it and whether they should be disciplined.
One of the beauties of most of our electronic health systems within hospitals is that there's log files. The privacy officer can go through and have a look and see exactly who opened the file, when they opened it, and what parts of the file they accessed. So once you become aware that somebody may have looked at someone else's record, you can usually go back and find out who and when and what they saw, which can be very helpful in an investigation.
And in my experience, when that happens, most of the time it's someone opening the file either through ignorance and not understanding what they're doing, or they've been asked by someone to do it, can you just check on my cousin? And they don't really understand that this is really a violation of someone's privacy and against the policies of the organisation. It's not that common that someone would deliberately open a file who are completely unrelated to the patient, like it might be a film star or someone like that. That's pretty rare, and that's very serious.
As you said earlier, most of these letters sent out to the wrong person are done completely inadvertently, and they can be quite devastating for the person who initiated that transmission when they find out what they've done. What support do you provide to people who are found to have breached privacy inadvertently?
I'm glad you raised that, because my experience is that most people really do come to work to do a good job, and they're a bit surprised and appalled at their action when they discover that they've inadvertently caused a patient harm by disclosure of information. And even if it's the most trivial level, they are sorry for the most part, and they just really want to make it better for the patient. If it's more significant, like revealing the address of a domestic violence victim, they really are, in my experience, really truly aggrieved with themselves for being so silly as to release that information. And it might have been even as simple as someone picking up the telephone and saying, "I was Mrs. Smith in your ward today." And the simple answer of yes has caused problems for that patient. So in terms of supporting them, I think a good administration would actually meet with them and counsel them and support them and say, look, we're not necessarily going to be disciplining you or anything. What we really want to do is make sure that you understand the system and that you and your colleagues around you are adequately educated so that you understand the significance of some of the things you may say. So even that accidental conversation on the telephone with someone who says their auntie or their cousin is fraught with problems. So how to handle someone like that and say, I'm sorry, we can't reveal that information, and a way of actually approaching that issue for them.
Always being on your guard.
Always on your guard.
Let's talk about the Officer of the Privacy Commissioner. What information do you need to tell them, or when would you disclose a breach to the officer?
So, David, I don't think, at least in my jurisdiction, that there is an absolute legal obligation within the legislation to inform the Office of the Information Commissioner or even the Health Complaints Commissioner. However, as we move to a more transparent and open system, we should be alert to doing the right thing by the patient. And sometimes phoning the Information Commissioner or the Health Complaints Commissioner, they can give you valuable advice about how to respond to an accidental disclosure, and also assist you in actually reviewing some of your processes and systems so that you actually reduce the chance that these events are going to happen in the future. So it's a bit like APRA. They're often more a help in information than they are scary in terms of discipline or anything like that.
That's certainly my experience. They have a wealth of knowledge and understanding of the law and the implications for people, and can be extremely helpful. So the person whose information's been disclosed is very angry and they threaten to sue the hospital. Can they do that?
I would hope that by prompt response and by being very open, that you would obviate the challenge from a patient about suing you. Having said that, my experience is that it's extremely rare for people to be that outraged. If you explain to them how it happened, why it happened, it was unintentional, the nurse involved was trying to be helpful, all the patient asks is the standard things with any adverse event. In my experience, they'll say, I just don't want this to happen to someone else. And people are very generous generally about how they respond. Having said that, again, if they are threatening to sue you, well, that is out of your hands. My invariable response is to patients or to people threatening litigation, look, that's your right. Having said that, they would have to have suffered a substantial harm to have a successful civil suit brought against the hospital.
Agree. What about the hospital's insurer? What's your threshold for letting the insurer know that an incident like this has happened?
I have a very low threshold for telling our insurers anything. I think, again, they are a resource for you. Sometimes they will just receive the information, say, thanks for telling us, but sometimes having a discussion about it is actually very useful, and that can be quite helpful in helping you think about how you prevent further events happening.
Thanks, Colin. Any final thoughts on the scenario and lessons to be learnt?
Well, my lesson that I learned was the painful one. You have to be really alert and on your toes while trying to be helpful to people, not to disclose information which you may not think is significant, but others may.
Thank you very much, Colin. Very helpful.
Thank you for having me.
That was Dr Colin Feekery, a former Acting Director of Medical Services at Alfred Health. And that brings us to the end of this episode of Safeguarding Healthcare. I'm Dr David Rankin. Follow Safeguarding Healthcare free on Apple Podcasts, Google Podcasts, Spotify, or wherever you listen to podcasts. This podcast is produced by Sound Cartel for the Royal Australasian College of Medical Administrators.